Hello again. All right, so we're going to continue with our heart lectures, and now we're going to talk about the cardiac cycle. And this is going to include heart sounds and how the ventricles and atria contract, and when the atria and ventricles contract and relax, and how the blood is flowing through these structures. And there we go. All right, so what is a cardiac cycle? The cardiac cycle are all the events associated with blood flow through the heart during one complete heartbeat, okay? And so when the heart beats, it contracts and then relaxes. And we have a special terminology that we use for contraction and relaxation when we speak about the heart. We say systole and diastole. So systole is heart contraction and diastole is heart relaxation. That may not be totally new for you if you've ever had your blood pressure taken. If you say like 120/80, that's the systolic pressure over the diastolic pressure. So when the heart contracts, it causes the higher number, the higher pressure, and when the heart's relaxed, the lower pressure. So systole and diastole mean contraction and relaxation, and you probably have heard that before with blood pressure. Now the cardiac cycle takes a little less than a second. And that way you can have 75 beats per minute in a normal resting heart rate. Just a small amount of time, 0.1 is when the atria are contracting, atrial systole. About 0.3 seconds is ventricular systole, and about 0.4 seconds is total heart diastole, or relaxation. Now, part of the heart cycle has to do with the sounds that you hear. And when you listen to the heart, there are two sounds that you would expect to hear if you're listening to the heart, the stethoscope, or just put your ear up to someone's chest. And the sounds are lubbed up, lubbed up, lubbed up, okay? And you kind of have that P is kind of a sharp sound, lubbed up. It's kind of a sharp P sound. And those sounds are made by the closing of the heart valves. So as those valves close and snap shut, they make a sound. And the first sound, the lub, is the AV valves closing. So your tricuspids and bicuspids, when they are closing, and that's the beginning of ventricular systole. So the ventricles are beginning to contract. The second sound, the dup sound, that's when the semilunar valves, the PSLV and ASLV, when they close. And that's at the beginning of ventricular diastole. So you're listening for those valves closing as the heart is contracting and relaxing. Now, if you hear something abnormal, we call that a murmur. And so that is maybe an incompetent valve, a leaky valve, something like that. So maybe a whooshing or shushing sound instead of a crisp closing sound. Now, these heart sounds can be isolated. So if you've ever been to the doctor, and I'm sure you have, you maybe have noticed that they put the stethoscope in different parts of your chest while they're listening. And you may have thought they were listening to your heart and lungs, and you may have thought that maybe just one of those times they put the stethoscope on your chest was you're listening to your heart. Well, they are listening to your lungs, but when they're moving that stethoscope around, they're listening to the different valves. Okay, they'll also listen to your lungs on the back side of your chest. But to hear those four separate valves, they will move the stethoscope around. So that's really what they're doing in addition to listening to lung sounds. So this is where the valves are actually in the heart. Okay, so the yellow one is the tricuspid valve, the pink one's the mitral valve, the blue one's the pulmonary valve, and the brown one's the aortic valve. But to isolate that, the way when the valves close, kind of think of that sound as an echo, and so it kind of echoes off the chest wall. So the best place to hear it, the pulmonary valve, is going to be just left of the sternum between in the second intercostal space, so between those ribs. The aortic valve, again, between the ribs at the second intercostal, remember costal means rib, the intercostal space on the right side of the sternum. The tricuspid valve you can hear toward the right side near the fifth intercostal space, and the mitral valve is best heard toward the apex, again, near the fifth intercostal space, kind of in line with the clavicle, all right? And so that's what they're doing. They're trying to listen to those individual heart sounds and see if there is a murmur in any one of those specific heart valves. And they're pretty good at it. A good doctor or nurse can listen to your heart sounds and isolate each one of those valves. All right, so the cardiac cycle are those events in one heartbeat. Okay, and so this is a circle, so you have to start somewhere. You got to start with basically, we're going to start with the heart in diastole, so the heart relax. That's going to be our starting point. And in diastole, the heart is relaxed, and so all the chambers are fully open and relaxed. The atria and the ventricles are relaxed, and blood is passively filling in. Okay, so the blood is kind of pouring in from those inferior and superior vena cavas, the coronary sinus, and those pulmonary veins. So the right side and the left side, both those atria are receiving blood, either from the body or from the lungs. Okay, and because the ventricles are in diastole, the AV valves are going to be open, the semilunar valves are going to be closed, and the blood will just fall into the ventricles. Okay, so this is passive. It's just simply falling and filling up the ventricles. About 80% of the ventricular filling is passive, so it's just blood flowing in from the venous return into the atria and then into the ventricle. So once the ventricular filling, we need to complete that ventricular filling, and the way we do that is we depolarize the SA node. So we have the SA node depolarized, that spreads that impulse through the atria, and then that triggers the atria to contract, or triggers atrial systole. So the atria are going to contract and force the remaining blood into the ventricles. So that's going to end the diastolic filling. So all of the ventricles are going to be fully filled now, and we call that the end diastolic volume. So the ventricles are completely filled with a combination of passive filling and then that atrial systole pushing the remaining blood into the ventricles. Okay? Now the next step, the ventricles are full, so now we need to send that blood out to the aorta or the pulmonary trunk. So now that depolarization is going to spread through those bundle and through those bundle branches in Purkinje fibers, and that's going to start ventricular depolarization and trigger ventricular systole. Okay, so ventricular systole is contraction. So as the heart, remember it kind of contracts from the bottom up, as it starts to force that blood, okay, up toward those semilunar valves, okay, as it's going up toward those semilunar valves, it's also going to push up against the AV valves and shut them. So it's going to shut those AV valves as the blood is being forced up. So it just kind of snaps the trap door. And that's the lub sound. Now, what's happening is you have in the third step, as this ventricular systole is continuing, you have what's called isovolumetric contraction. And so for just a split second, the ventricles are contracting and the blood is just remaining in the ventricles. It's not going anywhere. So iso means the same. So even though the ventricle's contracting, the volume of blood in the heart is remaining the same. It's not moving. It's not going anywhere. Eventually, as you're squeezing on that blood, you're going to exert pressure on it. And that's going to open up enough force. The pressure inside the ventricles is going to be greater than the pressure that is keeping those semilunar valves closed, and it's going to force those valves open, and blood is going to go upward into those blood vessels. So the semilunar valves open when ventricular pressure is greater than the pressure in the aorta and the pulmonary trunk. So it's going to snap those valves open. That's not a sound. It's just pushing those valves open. That's not a heart sound. So now blood is leaving the ventricles out to the aorta and the pulmonary trunk. All right, so the last part is ventricular relaxation. So now the ventricles will repolarize, okay, and then they're going to start to relax. And so the second sound, the dup, is when those semilunar valves close. And this happens when the pressure in the aorta and in the pulmonary trunk exceeds the pressure in the ventricle. So now you force the blood up, and as the heart starts to relax, the blood kind of wants to fall back. And so now there's higher pressure in the aorta and the pulmonary trunk than there's the ventricle. So as it's falling back, closes those semilunar valves, okay? And then you get a temporary isovolumetric relaxation where the heart completely relaxes, and then the blood will start over and the blood will start to fall in. This temporary isovolumetric relaxation, this is the amount of blood that's left in the heart after the contraction, before the filling begins, and we call that the end systolic volume. So there's always a little bit of blood left in the heart. It doesn't completely force it all out in every contraction. Okay, so there's a little bit left, and we call that the end systolic volume. All right, and then lastly, the fifth step is going to be return to passive filling. So we're kind of at the beginning. So your venous pressure, venous blood return to the atria is going to increase atrial pressure. All right, so remember those AV valves were still closed, and so as the blood is returning from the pulmonary veins and the vena cava, it's going to start to fill that up. The pressure, they're going to get more blood, more weight, more force in the atria. That's going to open up those AV valves. So the AV valves open when atrial pressure exceeds ventricular pressure, and now the blood will start to fall into the ventricle and passively fill them again. Okay, so this is just a cycle of how the valves open and close as the blood is flowing through the heart, in conjunction with ventricular systole and ventricular diastole. So I say that because you need to be able to think of all of these things going on, and picture in your mind and on a piece of paper how all of these events relate to each other. Because we've talked about EKGs, we've talked about heart sounds, we've talked about pressures inside the atria, we've talked about pressures inside the ventricles, we've talked about heart sounds, we've talked about volumes of blood inside the ventricle, and we've talked about blood flow. And you have to be able to think about how all of these things are occurring and what things are occurring at the same time, okay? So I like this chart. There's several that you can find online in your books where you can line up what's going on at the same time. So for example, if we look at this ventricular filling, okay, what you see, you have ventricular filling is going on in this little step one of the phase, okay? You've got atrial contraction. Well, before the atria contract, look, you've got to have that P wave. Remember, atrial depolarization, that's the P wave. Well, you've got to depolarize the atria before they can contract, right? All right, so then you're going to see atrial systole. Well, that's atrial contraction. So all of these line up, okay? You can also see during this ventricular filling, the AV valves are open, the semilunar valves are closed, okay? You can see during the next phase, as the isovolumetric phase is going through, as you're increasing pressure inside the ventricles, all right, your AV valves are going to close, your semilunar valves are going to open. So you can kind of see this all in one diagram. So what you need to do is just really take some time. I would say this is where those infamous all that apply questions are occurring. So you may have a question that says, okay, at the time of the second heart sound, which valves are open, the which valves are closed. The heart's undergoing isometric contraction or isometric relaxation. Is the heart in systole? Is the heart in diastole? What portion of the EKG are you in? Are you generating a T wave, a P wave, a QRST? So just kind of think about how I could ask a question and ask you what all is going on at the same time. The other thing, I like this little green one. This is called the dicrotic notch. And that is the pressure in the aorta. And so you can see that when the ventricle is going through ventricular systole, when it's contracting, you're increasing the pressure in the aorta. Okay, so you're forcing blood to the aorta, increasing the pressure. And then when the ventricles relax, when that blood falls back and shuts down those valves, that's the dicrotic notch. It's the bounce. So the dicrotic notch is the bounce of the blood in the aorta kind of coming back and closing those valves. And that's what you feel as a pulse. That pulse is kind of pushed through the arterial system as a pulse, and that's how you feel your pulse. It's kind of that dicrotic notch bouncing off the valves. All right, so just take some time. This is a complicated slide, but it allows you to kind of see everything that we've talked about. We've talked about EKGs, we talked about heart sounds, we talked about pressures inside the ventricle, pressures inside the atria, which are going to be right here. We've talked about volumes of blood inside the ventricles. We've talked about the valves being opened or closed, and we've talked about how blood is flowing through the four chambers. So it's all in one page for you, kind of lets you wrap your head around what's going on and when. So trust me, there'll be some sort of either essay question or all that apply question that requires you to understand all of these steps in a more complete way. All right, I think that's the last slide. So if so, I will see you in the next video. Thanks a lot.